Okay, so hello, welcome, and thanks again for joining another webinar of the WHO Technical Webinar Series. Today we're going to talk about quality criteria for HNAPs, which is short for Health National Adaptation Plans. My name is Yiqi Pan, and I'm a technical officer in the Climate Change and Health Unit at WHO. So those of you that have already visited a couple of our webinars might be familiar with this slide because we have already done a couple on different topics. Excuse me. And we're almost at the end of our technical webinar series for this year. And today we're going to talk about the Health National Adaptation Plan with a focus on the quality criteria, since we have already done a webinar on HNAPs. So if you missed that one, you're very welcome to scan the QR code or enter the link, and you can watch the recording of our previous session on the web. We have interpretation today. You are very welcome to click on the interpretation button, and you may find the language that you're most comfortable with. So for the AM session, we have interpretation in English, French, and Arabic. Yeah. So now to the agenda. So right now we're talking about the housekeeping. And then in a few seconds, I'll hand over to Dr. Diarmid Campbell-Lendrum, who's the unit head of the Climate Change and Health Unit, WHO. Then my colleague, Dr. Amy Savage, will give the main technical presentation of the quality criteria in HNAPs. And this will then be followed by Dr. Borko Bajic's presentation on their experience in Montenegro. Excuse me. And then another, sorry. Then another presentation by Dr. Kabir, who is our colleague from WHO Bangladesh. I'm really sorry about this. We will then have an interactive group activity where we're going to have breakout rooms and have the opportunity to discuss the quality criteria a little bit more in depth, and come back to have a group feedback session, and then we're going to close the webinar. So on the housekeeping, so we set this up as a meeting so you can unmute yourself and also turn on your camera yourself. But we would kindly like to ask everyone to keep themselves muted if they're not speaking, just to keep the background noise minimal. We would like to join with the first Slido. So you can enter, you can go to slido.com and then enter the code that you see here, or you can scan the QR code to enter this. There is also a link. I hope you will be able to join this. We have a first question prepared just to have a little bit of an overview who's joining us today and what are your pre-knowledge on HNAPs. I'm seeing there's already some answers coming in. So I give people a few seconds to maybe join the Slido. Okay, I'm seeing we have a lot of people who joined where the country has already developed an HNAP, which is great, or have started. That's wonderful. So I'm going to keep the poll open. So very welcome for more folks to come in and answer the Slido. Um, but just be conscious of time. I think I would now hand over to Dr. Diarmid Campbell-Lendrum for the opening remarks. Over to you, Diarmid.
Thanks very much. Can I just check you can see me and hear me? Am I coming through okay? Great. Well, thanks very much, and compliments to Yiqi and Amy and the rest of the team for setting up another really interesting looking webinar, and also to Yiqi for showing resilience and adaptability in working through sort of the short cough that she had earlier. So I'm Diarmid Campbell-Lendrum. I'm the head of the Climate Change and Health Unit at WHO headquarters in Geneva. And I just wanted to say a couple of words to introduce this particular webinar. As you saw in the previous slide, this is part of an ongoing series. All of the webinars complement each other, so I would encourage you to join any of the ones that we still have on the list, but also to access recordings of previous webinars if you haven't done so. And they're all important, but I do think that this one is particularly important. So at WHO, we've spent a lot of time over several decades now supporting countries to assess the health risks from climate change and to start to identify responses. And in the past few years, we put a particular emphasis on developing the health components of national adaptation plans. So either standalone documents that are aligned with the overall national adaptation plan or the health component within the national adaptation plan. And the reason we think these are so important, it's so important to have these, and many countries now have them, but also it's important that they're good, is because we know that climate change has a very wide range of impacts on human health. And it's really important, we think, that countries have a plan which takes a comprehensive public health view of the threats that climate change poses. So it doesn't just look at one particular issue, but takes that wide view. So the health in national adaptation plans, we think, needs to be comprehensive public health. The national part of it is also really important to us because we now see that many different actors are starting to engage on health and climate change, often from quite specific issues. So you will have external actors, you will have development agencies, you will have UN agencies, banks, and so on, starting to engage on this. But we think it's really important that the country has the ownership of it. So we are very much in the business of supporting national actors to develop their own plans around which they can then invite external support. And I would just finally like to put that emphasis on the alignment with the overall national response to climate change. So health is really important. It interacts with but it interacts with many other aspects of climate change. So it's also important what goes on in the water sector or what goes on in the agriculture sector and so on. So we do want to ensure that health is embedded and integrated within that, rather than having it as a completely separate activity, which is driven only by the health community without being part of the overall national response to climate change. Because we think if we do that, if we have a really good, high quality, comprehensive public health, nationally owned adaptation plan, then that will put a country in the best position to take those actions, but also to receive any external support that may be available in order to take those actions forward. So with that, I'd like to welcome you once again to the webinar and hand it back to Yiqi for the rest of the session. Over to you, Yiqi.
Thanks so much, Diarmid. And thanks so much for coming in for the opening remarks. I think that always puts things into perspective and gives us a broader context of why we're doing what we're doing and why we're all here today. Yeah, and I will hand over to my colleague, Dr. Amy Savage, for the main presentation. Over to you.
Thanks so much, Yiqi. Just checking you can hear me while I share my screen.
Yes, we can hear you.
And you can see my screen well?
Yes, perfect.
Okay. Thanks so much, Yiqi. Good morning, everyone. My name is Amy Savage, and I am a technical officer in the Climate Change and Health Unit at WHO headquarters. And I will be giving a brief presentation of the quality criteria for Health National Adaptation Plans, or HNAPs. Okay, my screen's a bit slow. So in this webinar, I'll be covering material that is part of a broader training package that we have. And as mentioned by Yiqi and Diarmid, we have had already several webinars in this technical series. And one of them was on the process to develop and implement a Health National Adaptation Plan. We had that webinar in June, and as the others, I encourage you to go and watch that if you haven't yet. We also covered the learning objective around the WHO operational framework for building climate resilient and low carbon health systems in a previous webinar. So I also encourage you to view the recording of that one if you weren't able to make it. And today we'll really be building on those previous two webinars and looking at some suggestions, some criteria to consider when developing the Health National Adaptation Plan to try and ensure that it is high quality and comprehensive plan. And just before we get into the main content, just taking a step back and looking at how do we build a climate resilient and sustainable health system, or climate resilient and sustainable health. We developed this visual guide for building climate resilient and sustainable health. And we can see that first, we really want to understand what are the health risks we want to address, what are the greenhouse gas emission hotspots if we're looking at that, what are the health co-benefits of climate action in other sectors. So starting with the assessments, and once we have that understanding, that evidence base, then we want to develop our plans for climate change and health. And this is where the HNAP comes in as a really critical component of climate change and health planning. And it's very complementary to the nationally determined contributions or the long-term low emissions development strategies. So they all work together for climate change and health planning. So you may be familiar with this, but just as a brief overview, the National Adaptation Plan is a process that was established as part of the UNFCCC Paris Agreement agenda, and it really aimed to reduce the vulnerability to the impacts of climate change and to integrate adaptation into policies and programs through development strategies, plans, and budgets. So as the name suggests, it is a national process. It covers a range of sectors that are vulnerable to climate change. And health, of course, is a really critical sector vulnerable to climate change. The Health National Adaptation Plan can be seen as the health component of the National Adaptation Plan. It is led by the Ministry of Health as part of this overall NAP process. And we would also recommend a standalone Health National Adaptation Plan that is usually more detailed than the chapter in the National Adaptation Plan, or the NAP, and it's particularly for the health sector. How will the health sector go about implementing those adaptation strategies to contribute to the overall national agenda on adaptation? The content that I'm presenting today is based on the WHO guidance that was developed and published in 2021. There's a QR code here, and I'm sure one of my colleagues can also drop the link in the chat. So you can go back and refer to this guidance at any time. And the guidance was based on, and these criteria are based on the decades of experience that WHO has in supporting countries to develop and implement health national adaptation plans. So they are based on country experiences. Now you can see all the quality criteria here, and it is quite a bit of content. We have grouped the criteria into 6 different areas, and of course I'll be covering those over the coming slides. But it's also important to emphasize that these criteria are not prescriptive, and they really need to be adapted to changing country context, uncertain and changing climatic conditions, and new knowledge and new technologies, but they do provide some key points to consider in the development of your Health National Adaptation Plan. So I'll be framing or presenting the quality criteria today in relation to these 4 steps of the National Adaptation Plan process that was developed by the UNFCCC and that was then adapted for the Health National Adaptation Plan. Again, these 4 steps were covered in the previous webinar, so I won't be going over the steps in a lot of detail, but talking about different quality criteria within each of those steps. So again, I encourage you to look at the previous webinar, review the recording if you're not very familiar with those steps. So the first step for the NAP process and the HNAP process is to lay the groundwork and address the gaps. So we really want to set up those institutional arrangements to make sure that the health sector is well engaged and well coordinated with the overall NAP process. Have a look at what evidence we already have and identify any gaps in that evidence. And then look at our national development priorities and how health adaptation will contribute and link with those. In terms of the quality criteria, the first group or area of quality criteria is strong leadership and political will and a supportive enabling environment for health adaptation to climate change. So we want to make sure that the Ministry of Health is leading the HNAP development and implementation. Also that the HNAP has government endorsement, even where, for example, the HNAP is developed by an external consultant or another organization, that the Ministry of Health and the national government is involved in the process, participates, and overall is able to take ownership of the plan. It's really critical for the implementation of the HNAP going forward. We also want to ensure that there is an active engagement of the health sector on an ongoing basis in the overall NAP process to ensure that health is considered not only for the HNAP, but also in the sectoral plans of other health determining sectors. And finally, to ensure that it filters down to operational levels so that health programs also become climate informed. In the case of Nepal, the Nepal Ministry of Health led the development of their Health National Adaptation Plan, and they recognized really on the importance of developing this health component of the National Adaptation Plan. A dedicated unit was created within the Ministry of Health to manage this overall coordination of the health sector in the National Adaptation Plan process. And the strong leadership that was shown by the Ministry of Health really enabled not only the development of the Health National Adaptation Plan, but prioritization of climate change and health at the national level. And the second area of quality criteria relevant to this first step of the NAP process, and also just to say that although I'm mapping these quality criteria to different steps in the process, many of these criteria may be relevant to the entire process, and particularly these early ones around the enabling environment, engagement of Ministry of Health, and cross-sectoral coordination and policy coherence. They will be relevant and cut across the entire NAP process, but they are particularly relevant at the beginning to make sure that these are set up early on in the development of the Health National Adaptation Plan. So in regard to cross-sectoral coordination and policy coherence, we want to make sure that the national health priorities and technical expertise are central to the national adaptation planning process. So it's not just the HNAP, but really well coordinated across sectors. And as I mentioned, that health is considered across sectors in their sectoral plans. So this could be looking at health co-benefits of climate action in other sectors, or conversely, it also could be considering that there may be some unintended negative impacts on health from climate actions in other sectors, and just to consider these and ensure that we're not doing things that result in maladaptation for health. So usually in countries, a cross-sectoral coordination mechanism is set up at the national level, and we want to ensure that health is is continually prioritized in that coordination mechanism. And this was particularly well done in Nepal, and they had very active consultation with the Ministry of Health, Ministry of Environment, and other sectors. The second step in the process to formulate and implement the National Adaptation Plan is around the preparatory elements. So for the Health National Adaptation Plan, if not already done so, we'd like to conduct a health vulnerability and adaptation assessment to really understand what the health risks are in the specific context, review the implications of climate change on health-related development goals, legislation, strategies, so looking at how climate change affects the health sector, and then develop a national strategy. And once we have those strategic goals, we can develop the Health National Adaptation Plan of Action. So the quality criteria most relevant for these steps is that we would like to promote comprehensive coverage of climate-sensitive health risks. So of course, the Health National Adaptation Plan should be evidence-based. And we recommend that the vulnerability and adaptation assessment is comprehensive, and that countries are ambitious in the coverage of the health risks they consider in the assessment, so that emerging risks are also considered, and then we have to prioritize. So the Health National Adaptation Plan, we'll mention a couple of times, is an iterative process. So we need to prioritize, and the different methods for prioritization are covered in the Vulnerability and Adaptation Assessment Guidance, and there was also a webinar on the VNA guidance earlier on, which you can also have a look at. So a case study from Ethiopia is that the Ministry of Health conducted their first VNA in 2015, and they found that climate-related extreme weather events such as droughts and floods were a continued threat, and the climate-sensitive health outcomes and risks that they prioritized included diarrhea, malaria, yellow fever, and dengue. And crucially, the VNA informed the development of the Health National Adaptation Plan. The other area of quality criteria relevant to this preparatory element step is comprehensive coverage of adaptation actions and options. So again, we encourage countries to be ambitious in developing or identifying adaptation options and actions for both medium and long-term timeframes. The Health National Adaptation Plan process is a long-term process. It's a part of a broader adaptation planning approach. So ideally, the adaptation actions that are identified cover actions for both building climate resilience at the health systems level. So looking at the WHO operational framework for climate resilient and low carbon health systems, those 10 components, and identifying adaptation actions relevant to each of those components depending on the country context, but then also developing adaptation or identifying adaptation actions that are addressing the specific climate sensitive health risks identified in the vulnerability and adaptation assessment, and also adaptation actions for specific vulnerabilities or vulnerable populations. And then again, to be realistic, these adaptation actions do need to be prioritized within the timeframe of the Health National Adaptation Plan, within the resources available, the capacities available. So the actual criteria to prioritize the health adaptation actions will depend on different factors. It'll depend on priorities of the Ministry of Health, the expected impact of the adaptation actions, and other criteria identified by the Ministry of Health. In Ethiopia, the VNA contributed to the creation of a multi-sectoral and multidisciplinary expertise, including knowledge transfer to universities. And one of the adaptation actions that was identified and that they've started implementing was the development of an early warning and climate-informed surveillance system for climate-sensitive diseases. So it's being piloted in 11 health facilities in Ethiopia. And again, we just encourage countries to be ambitious in the coverage of the climate-sensitive health risks, identifying medium and long-term priorities and actions. And even if not all of the health risks are able to be addressed in this specific iteration of the Health National Adaptation Plan, they may become emerging and more important in future years, depending on changing climatic conditions, and then can be considered in future iterations of the Health National Adaptation Plan. And just as an example, in the review of health in national adaptation plans that we conducted in 2020, so it's a little bit old, we're actually updating it this year, we found that most national or all national adaptation plans considered a range of climate-sensitive health risks. The risks that were most frequently included in national adaptation plans were vector-borne and waterborne diseases, and we can see here that 14 HNAPs included malaria, 13 dengue, and then diarrheal diseases and cholera were also very commonly identified. But what we also found was that there was a gap between those climate-sensitive health risks that were identified as priority risks and then specific adaptation actions in the national adaptation plans to address those health risks. So for example, we can see here for vector-borne and waterborne diseases that all of the national adaptation plans identified these as health risks. But the second line, the blue or the lighter green line, the second one, shows that the number of national adaptation plans that included actions to specifically address those risks. And we can see that it's less than the HNAPs that identified them. So there still is this gap between understanding what the health risks are, but then including specific actions to address them in the national adaptation plans. So now we move on to the third step of the process to formulate and implement the National Adaptation Plan. And this really is the implementation part. So we want to have health adaptation measures in the forms of policies, projects, and programs, ensure continued coordination of the health sector in the NAP process, and the HNAP can also be used to mobilize financial resources. It's recommended that as part of the development of the HNAP, we estimate the needs to implement the adaptation strategies. So that's both human and financial resources that are needed, and also capacity building needs to be able to implement the HNAP. And then using that estimation, we can develop a resource mobilization strategy. It's very clear that many countries will need to access international finance to be able to implement their HNAP. So it's important to identify what domestic resources are available and then what will be needed to access internationally and where we might start to consider submitting proposals to access those resources. So we have a short case study from Montenegro here, but I won't go into detail because we do have a speaker from Montenegro. But essentially, in their Health National Adaptation Plan, they had a very strong emphasis on the adequate allocation of human and financial resources. And a resource mobilization plan was a key element for the implementation of their Health National Adaptation Plan. And the final step of developing and implementing the National Adaptation Plan is reporting, monitoring, and review. So from a health perspective, we can look at strengthening health monitoring systems for health vulnerability, health systems resilience, and for example, developing an integrated surveillance and early warning system. We also want to make sure that we're integrating health indicators across other sectors where relevant in other health determining sectors, but also including climate indicators within national health monitoring systems. And again, iteratively updating the HNAP. So ideally, it's probably every time the NAP is revised, but that also depends on the country context. It depends what's happening in the health sector. because as we start to monitor and evaluate the implementation of the Health National Adaptation Plan, we will likely identify areas that need to be updated or modified to achieve the goals we're trying to achieve. So in terms of the quality criteria for monitoring, evaluation, and reporting, it's recommended that a comprehensive monitoring, evaluation, and reporting plan is included in the Health National Adaptation Plan, and that the HNAP is updated periodically. This figure on the left is from the Health National Adaptation Plan of Tanzania. So this is their M&E framework. And essentially in the M&E framework, we can consider monitoring whether or not we're implementing the adaptation actions in the HNAP. So this is really process monitoring. Are we doing what we said we would do? But then we also want to look a little bit higher at evaluating whether or not we're reaching some of those strategic objectives. So are the adaptation actions achieving the objectives that they set out to achieve? And then finally, over the longer term, of course, we want to evaluate, is the Health National Adaptation Plan achieving our overall objective, which is usually to build a more climate resilient health system and also address those specific health risks and those specific vulnerabilities. So we can include indicators at all these different levels in our monitoring and evaluation plan. And the other thing that's included in the quality criteria is to try and ensure that the monitoring systems are aligned with existing health monitoring and evaluation systems, with the national climate change monitoring and evaluation systems, to as much as possible reduce that burden on extra monitoring, extra reporting. So in summary, there's a lot of content. Again, it's available in the guidance, but overall, we suggest when developing the HNAP, when implementing the HNAP, looking at ensuring that there is strong leadership, particularly from the Ministry of Health, a supportive enabling environment to continue active engagement in the National Adaptation Plan process. Also, cross-sectoral coordination and policy coherence is really important, ensuring that health is considered not just in the Health National Adaptation Plan, but across the sectors in the National Adaptation Plan. We encourage comprehensive coverage of climate-sensitive health risks to capture any potentially emerging health risks. Also comprehensive coverage of adaptation options and actions. And even if these are not able to be addressed feasibly within the first iteration of the Health National Adaptation Plan, they can be considered in further iterations. It's also important to consider the resourcing of the Health National Adaptation Plan, estimating the resources, and then a strategy for how we can access those resources. And finally, to monitoring, evaluation, and reporting to understand if we're achieving what we want to achieve, but also ensuring that health indicators are considered in other sectors, monitoring and evaluation. Thank you very much for your time. And with that, I hand back to Yiqi.
Thank you, Amy. Thanks for the presentation. I hope that was interesting and enlightening for everybody. I'm sure it was. And we will also dive a little bit deeper into the content that Amy has presented later in the group work. But for now, I have the pleasure to hand over to our next speaker, and Amy has already alluded to him, and that is Dr. Borko Bajic, who is the head of the Department for School and Occupational Hygiene of the Institute of Public Health Montenegro. I see Dr. Bajic has already shared his screen. Wonderful. So go ahead. Thank you.
Thank you. Thank you very much. It is my pleasure to be here today and to have opportunity to tell a few words about our experience in the process of developing HNAP in Montenegro. I will switch to presentation mode now. I hope that is visible. Like previous speakers said, in our efforts to build National Health Adaptation Plan in Montenegro. We rely mostly on WHO experience, but for the beginning, for the colleagues from countries who don't know much about Montenegro, I will say only briefly about the effects of climate change in Montenegro, where as other Mediterranean country in Montenegro, we have due to geographical location, topography, and socioeconomic characteristic, we are particularly vulnerable to the effect of climate change. The results from the projections are not good. We expected a rise from 1.5 to 2 Celsius degree by 2040. And the impacts of climate change are already visible in Montenegro and are expected to result in additional impacts in key sectors, including, of course, health and water sector. And the average temperature in 2023 was 2.5 degrees higher than the climatological norm. And 2023 was the warmest year over the large area of the country, and we expected that in this year, when all estimation and projections are finished, and reports that will be warmer than the 2023. So the temperatures are rising. In this slide, you can see kind of a roadmap on developing our Health National Adaptation Plan. We called it, according to our legislation, Program on Climate Change Adaptation in Health Sector. And in this process, which started in 2017, we started, of course, with the WHO help and organized the initial workshop where is agreed that this process should be developed through an inclusive process with active participation of all relevant institutions. Let me use this from this initial meeting and report from this meeting. We followed on in the formation of working group. I had the pleasure to lead this working group for different colleagues from the health sector for initial meeting in order to engage colleagues from other sectors. We had broad participation also not only from health sector but for other sectors, which is very important later to present the our document to other stakeholders, let me say that, and institutions. Because our goal from the beginning was to provide the synergy and inclusiveness and to provide synergy among the already existing strategies and plans from the field of climate change and environment and health, and to see also in the process of developing this program to strengthen in the way and to define the mechanism for better coordination. And of course, to take into consideration also the goals and priorities of, by that time, existing EU action plans and goals. And like previous speaker said, WHO is working in this field for quite a long time and had a lot of presentations and a lot of quality documents. Two of most important ones that we used are I'm pointing on right now by that time. So we formed a working group, worked in different groups because we have representatives from all three levels of healthcare: Ministry of Health, primary health care, secondary, tertiary level. So primary health center, hospitals, Institute of Emergency Medical Care, Montenegro. So we divided in different groups and we took the representatives for the meetings from that group. It is very important to select and to ask for the people who know the infrastructure and who know who was there for some time from that institution. That doesn't have to be, in my opinion, managers or directors of the institution. It is most of the time we have the very good inputs from the technical staff from the institutions and from the field. So we continue in our process, creating a first draft, then presenting it to the Ministry of Health, then organized in 2019 stakeholders roundtable And in December 2019, we presented it to send it to the government for adoption. So it was our roadmap. It lasts for some time. Actually, it starts much earlier than 2017. We start working and talking about climate change and impact of health earlier, but the right time was here when we have the support from and leadership from the Ministry of Health. We came in 2017 again with the help of WHO and the exchange and country visits that was organized prior to this. Let me proceed, and I will not speak here in detail because we have a very big adaptation plan followed by an action plan focused on the two major strategic objectives. One is to reduce the vulnerability of health sector to climate change, and the other one strategic objective is to improve measures to adapt the health sector to climate change. So in these strategic objectives, we had 6 operational objectives. Like previous speaker said, we tried to cover all the aspects of impact of climate change on health and to define our, let me say, road, because we were starting back then in 2017. We tried to be as comprehensive and to see an overarching, to see and to define these major, let me say, impacts and opportunities we had. Regarding quality criteria, I will focus on comprehensive coverage of climate-sensitive health risks. Back then, we do not have vulnerability assessment, so we rely on desk review of all available evidence, and that is very important to be collaborative and to see all strategies and documents for other sectors, like previous speakers say, not only health, but also water, agriculture, tourism, and other sectors related to health, not directly, but pretty much indirectly. And priority actions areas were identified through this collaboration, and action plan has 3 levels of performance to track the progress towards climate resilience readiness. First, we started that we do not have a sufficiently prepared system, public health and health services, to respond to climate change. So we need to strengthen this system, and the final product should be prepared system, public health and health services, to respond to climate change. So what is our goal was to support integration of health issues into climate change related policies, measures, and strategies. I already mentioned to strategic health sector engagement, for instance, in emergency planning for extreme weather events, and to support strengthening health, social, and public health system and services through integration of climate change into health policy, strengthening environmental health laboratory and public health services, and strengthening surveillance on climate-sensitive diseases. Of course, to raise awareness of and build capacity of mitigation of climate change and health risks, we spend a lot of time in estimation of human, financial, and other resources. But for this presentation, I was focused on this climate-sensitive health risks, because in my opinion, that is a starting point, and we should go and do that in the right way. Of course, challenges were there and still are in some degree. Low awareness and understanding of climate impacts of climate change in Ministry of Health and other health determining sectors. We had in last few years frequent changes in our government, lack of evidence, and also lack of resources, having in mind that we have pandemics all over the country, so our resources and planning for other sectors are pretty much deteriorated or lower than it was planned. I like to add in the end that we had a HNAP project which started in 2 years ago, and is supposed to be finished this year. And actually having this Health National Adaptation Plan was a good starting point to involve health sector in this National Adaptation Plan. And I will not, because of the lack of time, I will not read all of this, what our NEP project took from the health sector, but it is very much here in this last slide. We can see that we used our National Health Adaptation Plan as a starting point in building National Adaptation Plan, and we picked up the most important measures we are also envisaged in our Health National Adaptation Plan, and we are waiting for this National Adaptation Plan to finish and to see the resources. And of course, this adaptation plan has defined resources and timelines for implementation of these activities. And like Amy said, we are now planning to update our Health National Adaptation Plan as a parallel document, and who is going to the engagement of health sector more deeply and more, let me say, more constructive for health sector in the way that the National Adaptation Plan is covered among the health sector also. Three different sectors: agriculture, tourism, and water sector. So with this, I would like to finish my presentation. I'm very happy for this seminar series, and for, of course, WHO help, which is very much important throughout all this process. And we are having been the focal point for the environmental health process for some time. I knew a lot about the climate change and health, and I was a member, and still I am of the HIP working group, Health and Climate. But we have to work more to strengthen and raise the level of understanding in our ministries and among our co-workers in health sector about the impact of climate change. And with that, I would like to finish. Thank you very much for this time and for this opportunity.
Yeah, thank you so much, Dr. Bajic. I think that was a really impressive presentation, and just showing that the HNAP process is really a process and that we need to continuously work on. And thanks so much for sharing the experience. And also the last table, I thought, shows very well that despite our ambitions and despite our knowledge that we need to take a lot of actions, we sometimes have to prioritize. So thanks again for sharing. I would now like to hand over to Dr. Kabir, who is Program Officer in Climate Change at WHO in Bangladesh. I think...
Yes, I'm here.
Great.
Can I show the presentation? You told me that
I think
presentation.
you can. I wonder whether, Dr. Bajic, you have to stop sharing in order, because I think...
I will, just to see how stop share. Okay, I find the button.
Wonderful. Okay, that worked.
Thank you.
Thank you so much.
So good morning, good afternoon, and good evening. This is Ahammadul Kabir, working at WHO Bangladesh as Program Officer Climate Change.
Okay.
So basically in this presentation, I will show you how the quality control measures of developing the Health National Adaptation Plans was maintained in the development of HNAP 2024, when the first HNAP was developed in Bangladesh in 2018. So next slide, please. So first of all, I would like to say that during developing the Health National Adaptation Plan, health sector need to be considered as a separate sector, because we are observing that the climate change impact is not only a cross-cutting issue on health, but it is also directly impacting the health system of the country. Recently, Bangladesh National Adaptation Plan was published, and it identified 11 climate stress areas in Bangladesh. And these are very diversified geography. You know, there are some flood-prone area, some low-lying area, hilly area, coastal area. So events, climate-related extreme events are different in those areas. So we think that among the relevant stakeholders, including health policy makers, professionals, workers, program designers, program implementers, civil servants, civil society members, their understanding on the health impacts of climate change and its adaptation should be increased. So there is a need to develop a concrete adaptation plan for health sector. Next, please. The first Health National Adaptation Plan was developed in 2018, and it was basically based on WHO framework for building climate resilient health system and health vulnerability adaptation assessment conducted in 2011. And after 10 years, the Ministry of Health completed the second health vulnerability and adaptation assessment, and the 2018 Health National Adaptation Plan was updated in 2024. And in the meantime, in 2022, the National Adaptation Plan was published. The HNAP Bangladesh is a comprehensive document designed to guide the country towards building resilience to climate change impacts on health by empowering communities and individuals through an adaptive and sustainable health system. Next slide, please. So this is the Health National Adaptation Plan, which recognizes the development of the Health National Adaptation Plan that was developed in 2018. And they mentioned in their document that this plan will be mainstreamed while the NAP implementation plan will be prepared. And that is why with the technical assistance of WHO, the Ministry of Health has updated the Health National Adaptation Plan 2018. Next slide, please. So aims of the HNAP is to give strategic guidance to the Bangladesh health sector for establishing a climate resilient health system, including increased capacity, to plan health adaptation measures, to prevent and overcome existing and future risks, and to respond promptly to climate change risks for health and well-being. It was developed basically by considering the WHO framework for building climate resilience on health systems, 6 building blocks, basically leadership and governance, health workforce, health information system, essential medical products and technologies, service delivery, and financing. Next slide, please. So now I would like to explain how the HNAP 2018 and 2024 differ. So the first HNAP was guided by a few documents. That time, we have less literature on the impact of climate change in different geophysical areas of the country, relevant policies and legislations, and everything was basically reviewed in 2018. And we have conducted two consultation workshop at national level and one at regional level. And also this HNAP was basically led by IDCR, I mean, that is Institute of Epidemiology, Disease Control Research, and CCHPU, Climate Change Health Promotion Unit, and Health Ministry and health stakeholders. And the guiding documents were the Climate Change and Health Vulnerability and Adaptation Assessment that was conducted by IDCR with the technical assistance of WHO in 2011. And it considered the health adaptation strategy, health population nutrition sector development plan of the country, and Bangladesh climate change strategy action plan, and WHO's operational framework for building climate resilient health system. Next slide, please. And the 2024, the updated version of the 2018 HNAP, the scope of work, scope of activities has been expanded to include more issues of health due to the impact of climate change here. And the number of guiding documents has been increased because in the meantime, the National Adaptation Plan was published by the Ministry of Environment, Forest and Climate Change. And we also considered the health policy, Health vulnerability adaptation assessment. Those are conducted in 2015 and 2021. And 2018 Health National Adaptation Plan, Nationally Determined Contribution NDCs, and Health Population Nutrition Sector Development Program that was updated recently. And the whole process was led by a technical group where the peoples from different corners, like the Ministry of Health, the Ministry of Environment and Forest, the Ministry of Defense, all are involved. The representatives from each of the ministry and their relevant departments, they are leading the technical work group. And also the literature in the meantime from 2018 to 2024, there are so many researches has been conducted on climate change and health. These were reviewed, policy and legislations were reviewed again. And also we conducted, this is the new one, the technical workshop. The last 2018 HNAP, while it was developed, that level of technical workshop was not conducted with the relevant line directors of DGHS and NGOs working in the field of health and climate change. In this technical workshop, basically, we have collected their experiences, their views, their ideas, and their thinking on the impact of climate change in Bangladesh. And also we have conducted some key informative interviews with Director General DGHS, Additional Director General DGHS, Director NIPSOM. This is NIPSOM is and Director Disease Control, Climate Change Focal Point of Ministry of Health, and also the other relevant sector professionals, health professionals. And the new edition here in 2024 HNAP is we have included a implementation roadmap, how this HNAP will be implemented in next 5 years, and with costing and its cost benefit analysis. Next slide, please. So if we see that the contents of these two HNAP, the first one was developed in 2018 and second one is 2024. Almost there are some changes. The 2018 there is a separate adaptation plan, and we have some update. We have some information from the climate sensitive disease outcomes in different geophysical area of the country, institutional policy framework, and climate resilient health system, how it could be developed, and implementation strategy, monitoring, evaluation, reporting, stakeholder engagement. These are the major contents of HNAP developed in 2018. But in 2024, we have included the most important one that was absent in last time, not up to the mark, that is the financial strategies and its action plan of implementation from 2024 to 29 with costing and cost benefit analysis. This is the new edition of 2024 HNAP. And the disease outcomes, climate-related health risk and disease outcomes in different geophysical areas were updated in this 2024 HNAP. And the health issues, objectives, and adaptation plan, these were included here. So these are the red color text are the difference between the 2018 and 2024 HNAP. So next slide, please. So let us consider the improvement of HNAP quality. So the main criteria, there are 4 main criteria, of which we are considering 3. That is leadership and enabling environment. So first sub-criteria is the Ministry of Health leads the development. Yes, both the HNAP, the Ministry of Health leads the development, but this time the ministry directly involved with this development, and also the other sector organizations are involved. So they are involved through forming a technical work group. Later on, I will show you who are the peoples in the technical work group. So both of the HNAP was led by the Ministry of Health, and government endorsement and approval. Actually, the HNAP 2018 was pending because in late 2018 it was completed, but later on COVID-19 spread all over the country, and then that became the priority issue in the country, and we cannot move forward with that one. And then in 2024, I mean, in 2021, the second health vulnerability and adaptation assessment was completed, and also NAP indicated that the HNAP will be mainstreamed during developing the implementation plan of NAP. So we used that one and we updated the HNAP 2018, and the process of government approval is ongoing. It is final draft is in our hand, and now the review process is going on. And considering the country situation, political situation, I think in the late this year we will be able to get approval or endorsement from the ministry. Active engagement of health sector in process to formulate and implement NAP. Yes, because we have conducted a number of workshops with the government line directorates and also with the NGOs working in the health sector, as they are directly engaged with this development. So they have developed a ownership, and they also try to implement this HNAP. They're trying to implement this HNAP through their normal health related programs. Climate informed health planning and programming, and this time the programming and planning, I mean, a number of actions were included, which was absent in HNAP 2018. And this time it was more robust, and every specific actions has been written here. Comprehensive coverage of climate sensitive health risks. This is the second criteria. Was a comprehensive VA assessment done before the HNAP? Yes. In both cases, we have done a comprehensive health vulnerability and adaptation assessment. But in 2011, the V&A assessment, we considered two geophysical areas. One is the coastal area and another one is the drought area. But in 2021 vulnerability adaptation assessment, we considered all the geophysical areas of the country: the hilly area, the coastal area, the drought area, the flood area, and also the low-lying areas. So this is more robust than the previous one. So resourcing, is there any estimation of required resources for HNAP? And yes, in 2018 HNAP, there are some guidance on this, but this is not that was not I mean enough. So, and implementation HR finance, I mean, to implement the HNAP we need HR and finance, but that was not mentioned in the 2018 HNAP. But in 2024 HNAP, both the items were clearly mentioned with costing and budgets there. And there is a resource mobilization strategy added in the HNAP 2024. As we have not started implementing the HNAP, so the monitoring, evaluation, and reporting criteria, we are not, I'm not presenting this. The next slide, please. So see the peoples in the technical work group from ministry, health ministry, and also from ICDDRB, one of the international organizations, the Department of Environment, which is under Ministry of Defense, Bangladesh, which is under the Ministry of Environment, Forest and Climate Change, and also representative from Bangladesh Meteorological Department, which is under Ministry of Defense. and WHO technical professional and also the program manager. So there is a provision here that if this technical work group, when they are going to finalize this one, if they consider to include from other sectors, they can. We have kept this provision in this technical work group, and they have a specific TOR how they will how they will approve this HNAP 2024, and they will also take action to get approval from the Ministry of Health. Next slide, please. So here are some tips. I mean, it is obvious that before developing the HNAP, we need to conduct the vulnerability and adaptation assessment. This will give us a lot of information on the CSDs and also the climate vulnerability. And also we need to build a rapport with the health sector, government and non-governmental organizations for prioritizing the climate change impact on health. This can be done by leading and communication and rapport building. And also ownership is very important. I mentioned earlier that we involve all peoples, I mean, from the health ministry, departments, major NGOs working in the field of health, and the NAP authority. This time we also involved a person from the Ministry of the focal point of climate change in Ministry of Environment, Forest and Climate Change in the technical work group. So this will lead this will build the ownership among these peoples, and that will be helpful for us to include it in the National Adaptation Plan. And also resource availability is very important. I mean, everyone need to consider the doable activities. I mean, do not be ambitious because resources are limited and future is very unpredictable, you know. So considering HR, technical and financial resources, we need to identify some specific activities for a definite period of time with the financial resources availability and HR availability. So that is very important. Otherwise, it will be a document that we cannot implement. So this is very important while considering to develop the Health National Adaptation Plan. So thank you very much. This is the last slide I have presented. If you have any question, you can ask. Or
thanks so much, Kabir. Thanks for this really illustrative example showing the Bangladesh process, and really appreciate the comparison between the HNAP 2018 and 2024, and also showing that each iteration is there also to learn from the previous processes and also improving step by step. And also thanks for pointing out the importance of implementation and of resourcing, because of course we can create a wonderful, perfect HNAP that is high quality, but if we do not have the resources to implement it effectively, then the best plan does not lead to the goals that we hope to achieve. So thank you. And now we're going to move to the group work. And for that, I'm going to share my screen. Just bear with me with 1 second. Okay, so we will have the opportunity to talk a little bit about the HNAP and also the quality criteria. So we will have 3 breakout rooms. So we will have one main room that offers interpretation. So kindly to those who would require interpretation, you can stay in the main room. Then the main room is going to talk about these two quality criteria, leadership and enabling environment, and cross-sectoral coordination and policy coherence. Then for another breakout room, we're going to talk about comprehensive coverage of climate-sensitive health risk and comprehensive coverage of adaptation options and actions. And then for the last breakout room, we're going to talk about resourcing and monitoring, evaluation, and reporting. Participants can choose the breakout room that they're most interested in. I think I have another slide on the interpretation, just as a reminder. So if you require interpretation, stay in the main room. Other than that, choose the room that you're most interested in or where you think your work is more relevant in. And we're going to open up the breakout rooms in a second, and you can then click which one you want to join. So I see you on the other side.
Thank you to all the participants in my breakout room who contributed. Okay, Yiqi, do we have everyone back?
Yes, looks like it. I think someone maybe still coming back. Okay, so
Okay.
thank you everyone for the discussion. We are almost at the end of our webinar. So I shown in the agenda previously that we would typically do a reporting back, a quick reporting back, but given the time, I think we would just move to the closing slide. We have another Slido question, and I will show it. And with that, 1 second.
Hi, sorry, could you share the link to the mural, the Jamboard, please?
So we'll share all the Jamboards as a PDF in when we share the recordings with all the materials on the website that we provided earlier. We can add the link again into the chat.
Yeah, please add the link to the Jamboard in the chat so I can provide my inputs. Thank you.
Okay, great. Thanks for that. We have another final Slido question. Can scan the QR code or join at slido.com and type in hashtag WHOCCH and you'll find the question. And we would be interested in what is one key action you think would support the country in the HNAP development implementation. Okay, we're saying advocacy. So we're going to keep this Slido open, so you feel free to join, and we're going to post, as Amy has just posted in the chat, we're going to post the recording and the Jamboards and also the Slido results on our website. So with that, I would like to thank everyone for participating and contributing to the discussions. I hope it was helpful and hope to see you in another webinar. Thank you. Bye.